So if you have what's referred to as overactive bladder or urgency incontinence, if you have pain in your shin and pain in your groin, these are actually potential signs of what's referred to as trigger points of your adductor muscles. So that's what this video is all about. Stay tuned. So a lot of times we look at different symptoms, especially if they're not really in the immediate area of a problem. We look at them as if they're not related. And this is a great example of things that are really not immediately at the location of your main problem, but there's telltale signs of something related to that issue. You may be suffering from urgency incontinence or overactive incontinence, but trigger points in the muscles of your adductor muscles, those are the muscles in they're actually part of your pelvic floor muscles related to your hips and your pelvis. Adductor muscles allow your legs to go inward towards midline. So they're right here. So your adductor muscles, if you have trigger points there, they can actually cause pain in the shin. They can cause pain in the groin. They can cause pain on the same side, front and inward part of your thigh. And they play a role with urgency incontinence. They're very easy to get rid of, very, very common. So why adductor muscles? Think about it. If my base, my pelvic floor, the bottom of my pelvis is not strong, the brain knows it before you do. So it tries to mechanically create a support. So a support for a structure that is not strong is to put like a two legs going inward, like a triangle at the base of it to hold it up like a tripod. So that's your body's natural way of trying to create a support and stability for a failing or weak bottom. So be aware there's such beautiful way to handle these things, and injections and medications and pads and tools and devices many times are not even necessary if you address them in time and correctly. Most of the times that's not happening. If you want to understand more about how your posture and movement and your joints play a role with your pelvic floor dysfunction, which is something you may not have even thought about, contact one of the methods of contact in the description box. If you need help getting evaluated to see if that is your story, give us a call. Thanks for watching.